A free hepatitis B and cervical cancer outreach campaign is ongoing in and out of the littoral region. The campaign is spearheaded by the Salvation Medi-Rescue Mission for Africa (ESMA), a non-governmental organization who has its mission to reach out to the poorest communities in Africa as a whole and Cameroon in particular. Dr. Simon Pichelano, a Cameroon medical doctor based in the US of A, says hepatitis B is an infection virus like HIV and it is very transmissible.
The hepatitis virus is like HIV infection. In fact, they are cousins. I call them cousins because they have similar, very similar means of transmission. In fact, they are transmitted almost the same way. First, body fluid. And what are the body fluids? We have blood is a body fluid, saliva is a body fluid, serum is a body fluid, semen is a body fluid. Any transmission from one person to the other will give, because when you have hepatitis, you have it in your blood.
But the good news, he added, is that it is very treatable and has a vaccine when early diagnoses are made. But he cautioned that it is very deadly.
It is so painful for anybody to die of a disease that can be prevented. Like hepatitis B, a full dose of 3 doses of hepatitis B vaccine can prevent the infection for life. Hepatitis B is a viral infection.
The risk factors are eminent.
Risk factors are factors that promote an infection. They are not the cause, but they promote. For example, a risk factor of hepatitis could be you living with somebody who has hepatitis. So if you avoid that person, you may not have it. The risk factor could be multiple sexual partners.
Meanwhile, cervical cancer is caused by a human papillomavirus. It is a disease not known by many, reason why a lot of sensitization campaign is imperative.
The cause of cervical cancer is human papillomavirus infection. When the cervix is infected, the lining of the cells there begin to change because of the infection. They start changing and multiplying and dividing haphazardly and unstoppably, uncontrollably.
Cervical cancer progressive in the human system in different stages. Worse still, in Africa, Dr. Pichelano says 7 to 10 women die every 2 minutes.
Every 2 minutes, a woman dies of cervical cancer. And the thing is, it can be prevented. In fact, nobody should die of it if we have this information circulated to everybody. We do our tests and then we take the vaccine.
He advised that regular checkup is very important. The Dan Broadcasting TV station was one of those reach-out centers where hepatitis B screening has been carried out. To note is the fact that ESMA has been affecting the lives of many in Africa for the past 14 years and are hoping that in the next 10 to 20 years, hepatitis B should be completely eradicated in Africa.